Good evening, ladies and gentlemen. Welcome to Value in Health Week in collaboration with the Life Sciences Hub Wales for our event this evening, Value-Based Healthcare and Industry. My name's Kath O'Brien. I, by day, am the Chief Operating Officer of Felindra University NHS Trust, and I'm also a board member of Life Sciences Hub Wales. And it's my great pleasure this evening to be the chair for this event. So the format is going to be 6 fantastic speakers that are going to keep us entertained over the next hour, followed with a question and answer session. But before we get on to our speakers, I'd like to just take a couple of minutes to share with you a video that explains the role and the objectives of the Life Sciences Hub Wales. So if you can bear with me a second, I'm just going to ask one of our colleagues to start that video up for us now. It'll take a couple of seconds to click in.
The rising costs and ever-increasing demand on health and care are among the biggest challenges faced by Western governments right now. Bringing innovation into health and care services can help deliver significant change. That is where the Life Sciences Hub Wales comes in. Our mission is to accelerate the development and adoption of innovative solutions for better health and well-being, understanding the needs.
Oh, we seem to have
Health and care services. We listen to the needs of our health and care services in Wales. We hear the challenges they're facing and work with them to understand their priorities. Working with life science innovators, we invite companies and innovators from across the world to work with us, share their solutions and apply them effectively to health and care services in Wales. We are excited by new ideas, we embrace creativity and love finding new ways of working that make things better. Leading, supporting and inspiring change. Our experience, expertise and insight into the life sciences sector, together with our understanding of the health and care needs of our population, enables us to lead, support and inspire change. To us, innovation is a fresh way of thinking. We know that sometimes the simplest ideas can have the biggest impact, benefiting the whole of Wales. When innovation works, we recognise the importance of scaling these ideas up and out, increasing its reach, so that everyone in Wales can benefit. We love a challenge and we're here to hear about yours. lifescienceshubwales.com at LS Hub Wales.
Thank you, and I can strongly recommend you having a look on the website. Just a little snippet there in the video, but an awful lot more detail on the website. Please take a look. So now it's my absolute pleasure to move on to our first speaker this evening. So Victoria Bates is from Swansea University, and she's going to share with us some of the research that she's been doing in value-based healthcare. Thank you, Victoria.
Thank you, Kath, and it's my absolute pleasure to join you all this evening. A little bit of background about me. I started my career actually as a nurse and a midwife, and I've had the pleasure and fulfilment of the last 25 years working in the life science sector for a number of different companies, including contract service organisations as well as pharma, and really had a diverse experiences both in the UK and in Europe, which has been fantastic. There's been a common theme to all of my roles, which has been how do you really start to deliver more value around the innovations that we bring to market, and value not only for us as an industry but also for patients and health systems. And that's been something that's been really important to me. And last year in 2019 I had the pleasure of working alongside colleagues, academics in the School of Management at Swansea University to undertake a piece of research to start to look at the skills and capabilities that are needed by the life science sector over the next decade to really think about how we can effectively collaborate together to deliver more meaningful value in our partnerships. The research that I did involved over 70 hours of transcriptions, nearly 50 leaders from health, very senior leaders in health across the whole of the UK, the life science sector, and that was pharma, that was medtech, and it was also some of our partners such as the ABPI and even the Life Science Hub in Wales as well contributed. So absolutely fantastic and really rich insight from so many different leaders. And there were some consistent emerging themes that came, and that's my opportunity to share some of those headlines with you this evening. And there were three common themes that consistently came up from leaders about what we need and the skills that we need in order to collaborate more effectively and really together deliver shared value. So the first fundamental theme that came up was making sure when we partner that we've got the right tools. And by right tools, what that boiled down to was actually we either need to look for a system or a partner where there's the right infrastructure there so that we can start to capture the data and the outcomes, or there is a willingness or an ability to actually be able to capture that through a workaround, some solution that allows us to really be able to capture the data and really start to measure the impact of what we're trying to do together. And the more that that can be interoperable, the better. So the more that it covers the whole pathway, the more that we can really start to articulate the impact and the value. So the right tools are the first theme that really emerged from the research. The second was around having the right processes. And there are a number of emerging themes that sat within the right processes. None of you will be surprised that the first one was governance, and really making sure that you have the right governance in place and making sure that that's agile. And I know for a number of us, that has been a real challenge to look at how do you contract in a way together that gives each party the confidence and the faith that the way that we're going to operate is allows us to manage risk and allows us to declare what we're doing in partnership, but actually that doesn't take a year or stall us in how we do that. And that when we think about the governance and how we set that up, thinking about some common aspects of that, making sure that there's joint sponsors from both organisations, both from the system side and from the sector side, in order to hold the actual partnership accountable and to make sure that the pace is maintained in actually delivering what we want to do in that partnership. Making sure that there's an exit strategy in order that if there are certain aspects that we both agree that there may well be the ability to stop or actually remove ourselves from that partnership. Making sure that it's not about just being there for a moment in time, thinking about how it can be transitioned to build whatever that intervention is to make it sustainable and last through the test of time. And thinking about how do you capture the learnings in the same way as the Life Science Hub we're just showing, to scale it, not just across Wales, but how can you export it so that other markets, other patients, other populations can start to really benefit from the value that you've actually delivered within that partnership. Another aspect in terms of right processes is looking at metrics and measurements. So starting to think about what do you want to measure together, which is absolutely fundamental and tends to come under three aspects. What financial aspects do you want to measure? Are you incurring more costs in a different part of the system by introducing a new innovation? Are you realising savings? How are you going to actually look at that and what are you going to measure? In terms of clinical metrics, what is it that your innovation or the change in the pathway is delivering that's different? How is that affecting clinical outcomes? And then most importantly, when we're thinking about value partnerships, what's the impact for the patient? What are the outcomes? How are they different? Is it allowing the patient to be independent, now no longer having to visit hospitals multiple times? Is it that the patient has a better experience all round? So again, starting to decide on what you want to measure from a patient perspective and ensuring the patient's voice is in there and shaping it. And then the final aspect on process that was shared by the leaders was, if you're going to change the way you operate, how are you going to incentivize people in order to be able to behave differently? Because people respect what you inspect. So thinking about rewarding and the right behaviors, what will that look like differently as you start to progress in your partnership? And the final theme, which was the most important consistently with leaders, was people. So how as a culture are you going to behave as an organisation going forward, and making sure you don't trip yourself up, so that the whole organisation, not just one individual, is engaged in a dialogue and an intent that is around value, and ensuring that everybody that then engages in that partnership are all behaving in the same way. Thinking about from a people perspective, when you partner, who do you bring to the table, and really leveraging the full skills within your organisation, not just one commercial individual. What about the governance skills, the communication skills, the analytical skills, the scientific skills? Really starting to think about who could be there from both the health system perspective, but also the life science partner perspective, to really make the most of that, and to provide really disruptive thinking in how we operate together. And then finally, probably the most important individual is the individual that is engaging in the partnership right from the outset, and starting to think about that individual. Who are you hiring? Who are you upskilling within your organisation, that is empowered, can make decisions for you and negotiate those decisions, understands enough about the system, and is able to work and network across that system to truly be able to bring the value on behalf of the organisation and make it a real success. So those were some of the emerging themes that came from the research. The other thing that a colleague shared with me recently is that as we partner, we really need to start to think about it a little bit like a Rubik's Cube. And when you start to play with one side of it, the significant and profound impact that you have on all the other sides, and starting to think about, if you're placing an intervention or an innovation in a space, what is the consequences of that to the patient, to the system, to policy? How do you support the reconfiguration and the upskilling so that people can really start to deliver the true value, and patients can benefit much, much earlier from the way that you start to partner? And that's absolutely critical. And one other thought to consider, which is fundamental at the outset of any partnership, is making sure that we all collectively understand what we mean by value. And that, again, that's something that can unravel if we don't actually sign up and we're clear to how we define that and what we mean. And that's really critical. And just one final shameless point, which is I've now relocated to Wales after many happy years living in England. But the partnerships and the experience that I've gained have been incredibly fulfilling. And one of the things just to say is, and I know when we were shaping this evening's talk, was why partner in Wales? What were the opportunities? And quite frankly, in having partnered in Europe and across the UK, consistently the aspects of partnering in Wales have been incredibly successful. And that's the policy environment, the fact that it's so incredibly supportive of really seeking to partner with life science and to make it a success, and everybody consistently is behind that. That the population, the size of the population, means that when we're seeking to innovate together, it's big enough that we can actually show the impact and declare it, but it's small enough that we can make it happen together. And the people, that there are amazing leaders from across the whole of the system that are really willing, candid, honest, and really willing to actually help shape the way that we operate together. And that's been really fulfilling. So it's with that, and with those thoughts, I'm going to pass over to Emma, who's going to share her thinking.
Thank you, Victoria, and good evening, everyone. Thank you for the invitation to be part of this panel. I'm going to offer some thoughts around the role of industry in value-based healthcare. So my name is Emma Clifton Brown. I am the head of the Health and Value team at Pfizer UK. And among other things, the Health and Value team is responsible for really working with health system partners to create access solutions that are sustainable, patient-centred, and I guess fundamentally value-based. So if you could just pop onto the next slide. So I think, you know, as we think about the limited resources that we face in healthcare, we really do believe that shifting our focus from volume, and that could be volume of services provided or volume of medicines prescribed, to a focus on value is critical. I think that value-based systems that align costs and outcomes is surely one of the most effective ways to get the maximum value from every penny that we spend on healthcare interventions in the UK. I think if we think about it, probably the UK has a fairly rigorous value-based lens already on the assessment of medicines through the way that we approach cost effectiveness. We have, you know, some of the world leading methodologies and academics in that space. But I think we probably need to evolve our definition of value, and both in terms of the outcomes and the costs that we consider, much like Victoria said. So for outcomes, from our perspective, you know, we feel really strongly that we want to amplify the voice of the patient. We want to work with stakeholders to understand what outcomes matter to individual patients, but also to healthcare systems and to the population. And when it comes to costs, I think, you know, we've reflected a lot over the last few months about how the pandemic has really demonstrated very clearly the link between health and wealth. And I think that has created probably an even greater imperative for us to try and look beyond budget silos and really think about that full system impact, the full societal impact and costs associated with different healthcare interventions. And from a Pfizer perspective, these are not just words on a page, these aren't just sort of bold aspirations. We really are already working with health system partners to co-create new value-based approaches, and I think perhaps most notably in Wales. You know, as Vic's already mentioned, you know, Wales offers an incredibly unique environment for testing and implementing value-based healthcare approaches. There is a very supportive policy environment, a really great healthcare system ecosystem, you know, that Vic mentioned, the population size, and the way that we have very integrated care models in Wales. There's a real appetite for innovation, and I think fundamentally the fact that it is backed up by some real world leading academic expertise in value-based healthcare helps a lot. So we've partnered with Swansea University to start to build infrastructure around value-based healthcare, to develop what we're calling pathfinder projects to help us test new approaches, and also to educate leaders in healthcare in the principles of value-based healthcare. And in fact, my colleague Jess Burton is going to be speaking about one of our pathfinder projects a little bit later this week on Thursday. She's going to be talking about one of our projects where we are working together to try and solve some of the historical roadblocks that have really prevented successful implementation of outcomes-based agreements, specifically for medicines in the past, and really coming up with sustainable solutions. So if you're interested to hear more about that, tune in on Thursday. But I guess just finally thinking about, why does this matter to industry? So if you could just pop the next slide on, both globally and in the UK. And I guess firstly, as I think about the new generation of medicines that are coming through, we have a big pipeline at Pfizer with some really exciting new technologies. I think we probably do need to rethink about the way we approach reimbursement. We need approaches that are clearly sustainable for the healthcare system, but also balance that with the need to incentivize industry to keep innovating and creating. And perhaps most fundamentally for me, why we're interested in this approach is what I mentioned at the start. It's about this ability to align outcomes and align incentives. So by creating a system that links payments with outcomes, I think we create greater accountability for service providers, whether that is providers of medicines or services or technologies, to deliver on outcomes, as well as sharing the risk when those outcomes aren't delivered. And I think in doing that and in supporting these value-based approaches to pathways and systems, we can really work together to create headroom, I suppose, for innovation that I think is really greatly needed in our system. So finally, just to close, just suffice to say that I think achieving all of this requires huge trust, transparency, and of course collaboration. Next slide, please. I think we need alignment across all of the huge number of stakeholders: government, academia, industry, HTA bodies, and probably many others, to agree on some of these critical aspects, like the outcomes, as I mentioned. What are the outcomes that matter most? I heard them recently described in a presentation as the give a darn outcomes, which I think is a nice way of thinking about them. How do we address the significant data challenges and the administrative burden that comes with some of these really data heavy processes? And of course, finally, how do we create a procurement framework that supports the delivery of these types of approaches with mutually agreeable goals and risk? And I think these, some of these critical challenges are things that we need to work together on. I'm sure we're going to have the opportunity to discuss these challenges in more detail over the course of this panel, and no doubt other panel sessions this week. So with that, let me thank you very much again and introduce you to David, who is the CEO at Concentric.
Thanks, Emma, and thanks for the invite. It's great to see Wales continuing to shine a spotlight on value-based healthcare. So over the next 3 or 4 minutes, I'm just going to, I think, build upon a little bit of what Emma's mentioned with a slightly different kind of focus, I suppose. So I'm Dav Lochran, a surgeon by training, now Chief Exec of Concentric Health. So we're a health tech startup here based in Wales. So Concentric is a digital consent and shared decision-making application, and it's by now used at a number of NHS trusts and internationally. So our mission as a company is to transform how decisions are made about our health, decisions informed by patient outcomes and shared by patient and clinician. So as well as digitising the paper consent form, we're also transforming the process of reaching informed shared decisions. So shared decision making being the principle that healthcare decisions are best made by both patient and clinician together, the clinician bringing the clinical expertise and the patient bringing the understanding of what their preferences, their priorities are. As one of the 2 previous speakers has mentioned, what matters to them. So for me, shifting towards value-based healthcare is a key element in removing potential conflicts between doing the right thing and doing the right thing for the business. Conflicts that, as a clinically led health company, you clearly want to avoid at all times. So I think it's quite interesting to think about how that plays out, at Concentric as an example, and the role that value-based healthcare could play. So the expected payment model for a consent application like ours would be that it's based on completed consent episodes. So what we would traditionally call an activity-based model. And indeed, that is the model for our initial contracts across both public and private sector. However, shared decision-making evidence suggests that an effective consent and shared decision-making tool might actually reduce the number of surgical procedures. So that's from a number of different reasons, but one of those is the visibility, improved visibility and understanding of alternative treatment options. And therefore, the completed consent episodes may reduce with an effective consent and shared decision-making tool. Which gives us an interesting situation where, as we get towards meeting our mission statement, our impact on quality of care increases, but our revenue might decrease. So for me, the message from industry should be clear. Shifting towards value-based healthcare and value-based procurement means that almost always doing the right thing in terms of health impacts is also going to be doing the right thing for the business. And that makes it easier to make the right decisions for our healthcare systems, but also it has lots of other impacts. So it makes it much easier to hire exceptional people who want to make a difference, come to a company, see the difference, see that the right decision making is being made to make a difference and stay. And also it just makes us a much better partner for other organizations to work with. So I also want to take the opportunity to highlight the role of shared decision making in successfully delivering on the promise of value-based healthcare. So we know there's huge variation in clinical decision making and lots of improvement to be made in terms of making decisions around what matters to the individual. So for me, it's a really kind of important message to stick with us is that meaningful shared decision making should be seen as a key checkpoint in delivering effective value-based healthcare. So I'll leave you with this kind of thought that a good outcome from the wrong treatment may still be a bad outcome. Thank you, and I look forward to Q&As. I'll hand over to Ruth.
Thank you very much, David. Hi, thanks for listening to me this evening. My name's Ruth and I'm the UK and Ireland manager for solutions at Zimmer Biomet. And I've been asked to speak this evening about really why value matters to Zimmer Biomet in what we make, and also how we've moved on from simply talking about metalwork. So Zimmer Biomet as a company was formed in 1926 and obviously has been providing a range of different orthopedic products for healthcare since then. And those products have always had a quality threshold. We work very hard on determining that quality threshold. We provide those for sports, extremities, trauma, reconstructive surgery, and we've been very effective on that over the years. But we've really focused, predominantly in the early years, we focused on clinicians, we focused on surgeons and on hospitals and what was going to make their working day better. And over the last 3 or 4 decades, we've been working more on a patient-centric or a person-centric approach. And that's been supported around about 2000. It was decided that we could no longer have our own intrinsic metrics for determining quality and that we would start doing a pan-industry measure. And so the Orthopedic Data Evaluation Panel was formed, comprising of surgeons and non-clinical experts, orthopedic experts. And they determined a metric that the whole of industry can now relate to, which in turn means that our customers now have lowered risk. They're confident that if they use the ODEP rating, that they're going to have lowered risk, increased safety, and as a result, they're going to increase their trust. And so moving on from that, we decided, well, we now know that we have a measure that works, but actually that's no longer enough for us in industry. Really what we want to do now is we want to deepen those partnerships as opposed to delivering a service. We want to be part of that service delivery. And so we started looking at how we could support hospitals more, very particularly around orthopedic delivery, obviously. And we were looking at what forms a deep and meaningful partnership with a hospital. And it really, to do that, we have to look at this end-to-end care continuum. So it's not enough to just provide a product and evaluate that product and say that that outcome is good. We actually have to look at other things that impact on that patient experience. And so we look from the point of either diagnosis of treatment or referral for listing, right through to the point when that patient episode has been finished, they've been signed off back into the community. And for us to do that, we had to look at a range of different things. We had to widen our stakeholder group. So we had to have a deeper understanding of the challenges that go on with hospitals, all the while keeping this patient-centric or person-centric focus in the middle. And for us to be able to truly be able to support hospitals, we needed to be able to help them to deliver a standardized message to our patients or to their patients and to their patient group. And the way to do that was to start forging partnerships with various different groups to help us to deliver that. In the case of digital technology, we partnered with Apple. And so we are able to drive digital technology into the orthopedic pathway where hospitals' budgets simply don't allow that kind of technological development. So we now can help hospitals to deliver a standardized message preoperatively. We can help hospitals to deliver exercise routines to their patients, but more importantly, we can help to evaluate what those exercise routines mean. So we can start looking at pain thresholds and we can start looking at exercise tolerance, and we can build a picture about our patients, which in turn, particularly in this kind of COVID arena, means that people can start looking at their waiting list, and they can manage their waiting list in a much more efficient and effective way. And they can cherry pick the patients who have the greatest need. So either their condition is deteriorating to the point where they need surgery, or maybe conversely, actually, they can come in very quickly. They're low risk, they can come in and go home very quickly. So from a COVID perspective, it's very supportive to the hospital. And again, at the other end of the spectrum, we can actually send these patients back into the community with some oversight of what they're doing. And we can help them to pre-optimize and rehabilitate so that they actually maximize that implant and get the best out of it, because ultimately that's what we want. We want the patient to have the best experience. And along with that, we also want to do some telehealth metrics. We want to measure what we're doing, and we want to work in partnership with the people that we're delivering this product to be able to then evaluate, well, has it been successful? If it hasn't been successful, how can we work this? How can we improve the product? How can we make it more suitable to your needs? And then along that patient journey as well, we obviously have the entire theatre experience, which is pretty critical. And you know, we are one of the leaders for robotic assisted surgery, slightly later to orthopedics, but we've been there earlier in other areas. And we also want to be able to deliver repeatable and sustainable and consistent outcomes for our patients, because we want to know that in the perioperative arena, which has always been a little bit ambiguous in the past, that we actually have some data that's coming out of that we can then merge with our pre and our post-operative environment. And we can actually assess what we're delivering for our patients. And it's pretty critical, really, that we have these deeper relationships with hospitals for them to have trust that we are not just delivering metalwork, and that we are not just wanting to draw money from a hospital, but we actually want to deliver value to that hospital. And we also look at processes. We draw in all the operations managers, we draw in C-suite, we draw in all the different divisions within a hospital to try to assist that patient to have a smooth and a planned and repeatable experience through that process. At Zimmer, at Zimmer Biomet, I should say, sorry, we have really driven the patient to the center of everything that we do. And we think that our mission statement really says that, which is about alleviating pain and delivering repeatable and valued outcomes that make patients' lives better. But as everybody has said, working in Wales is something that is really actually quite exciting, because they're taking the time to draw a line in the sand, stop, evaluate what they want to do, and then move forward in a very measured and consistent way. And it's not something that you see very often. And they have been prepared to take the delay in their service delivery, to have an integrated and a planned and a constructive service delivery moving forward. And I have really enjoyed working with hospitals and health boards in Wales, but also with Life Science Hub Wales, because of this very structured and very deliberate planned move forward with their service, with their healthcare service delivery. I think it's going to be exciting times to come. I think the things that Emma was saying about shared risk, and again, Victoria was saying about corporate behaviour, they're very pivotal to driving any value-based healthcare moving forward. But I do think that there are avenues through that we can negotiate, and that we can have really strong industry and healthcare relationships that help to drive the very best of latest outcomes. But I'm going to say goodbye for now, and I'm going to hand over to Ahmed Abdullah, who's from DigiFarm. And thank you very much for listening, and I shall no doubt enjoy the rest of the conversations going on.
Hello, good evening everyone, and thanks for joining. My name is Ahmed Abdullah. So I'm the founder and CEO of DigiFarm, and we're an organization that implements value-based pricing agreements and contracts. We're a Welsh-based company. And today I'm going to be talking about why are we interested in value and outcomes, the current state, and how we can then utilize them to then create a really sustainable and dynamic health economy in the future. So I'm sure we've all heard, these common issues about healthcare in terms of rising treatments, increase in chronic disease, which doesn't seem to stop or slow down at all, aging populations globally, a lot of inefficiency and wastage, the incentives that have been misplaced between all these key stakeholders within the health economy, which some of the speakers have spoken about today. And bringing all this together, what we have seen is the lack of initial focus in outcomes and value has led to these barriers in patient access. So payers for healthcare, whether it's the NHS or insurance company, cannot afford to provide patients access to these higher cost or innovative therapies. There are barriers and delays in market access. I mean, being part of the NICE process and looking at submissions from manufacturers to get into the NHS or even markets around the world, often the time utilized to negotiate and debate whether a drug or intervention is actually useful for a certain population that it's intended to treat can go up to 18 months. And a lot of the time, some of the patients that we're trying to negotiate access for, their mean survival time is around 7 to 9 months. And this is a system that didn't really make sense. Why are we relying on projections and things like that when the technology is now available to really look at value and look at outcomes? And again, if we're able to address this situation, we're able to remove this disincentive for innovation, eliminate this unsustainable expenditure within the health economy, and then really start looking at health resource allocation in a really sustainable way. And if you can just go to the next slide, please. So when we are looking at outcomes and value, they're hugely important because they are a key driver within economic evaluation, deciding where the money that we have available should be spent when you have a lot of competing interventions. And, one of the key, beyond the value equation, what we have something when deciding what healthcare to provide with a limited budget is something called, the cost effectiveness, the incremental cost effectiveness. And what you have, the requirement is to collect the costs of the intervention, the potential impacts, the cost of administration, And then what's really crucial is to then calculate, the effectiveness. And in many areas in the UK, especially, we focus on cost utility. And so the effectiveness is not just measured by the clinical effectiveness, but also the value, the perceived value of this effectiveness from the patient. And once we're able to collect all these data points in near real time using a really robust system, we can start moving towards a future state. And if you can go to the next slide, please. A future state that enables us to price flexibly and dynamically in near real time, accelerate access by enabling all these risk sharing agreements. If you're able to collect outcomes and value from some of these interventions over a longer period of time, then you're not able to just support commissioning, but also support decommissioning or the replacement of certain interventions in certain tariffs. The money you're able to save, you're able to reinvest it in other areas within healthcare. You're able to really create a patient-partnered health economy. Patient-reported outcome measures or patient-reported experience measures are extremely useful in supporting health resource allocation. And again, that's another reason why we really need to be able to collect these data points and share them really effectively. In terms of the indirect benefits as well, when you start to collect outcomes and really focus on value, is that patients can start to receive therapies where they are. They don't have to go abroad for any interventions or anything like this. And then really creating an environment that's encouraging innovation, that encourages organizations like Pfizer, like Zimmer Biomet to really work together with the payers and stakeholders within the system to provide the best therapies. And really that was just, I wanted to give you a short overview of why it's so important that we focus on value-based healthcare and outcome-based healthcare and collect them the right way. Because once you do that, you can really start developing a health economy based on what's really happening rather than projections and statistical extrapolations that are filled with uncertainty, but actually move forward with certainty and create a world-class health infrastructure. Thank you. And so the next speaker will be Matthew. Thank you.
Thank you very much, Ahmed. Good evening, everybody. My name is Matthew Pritchard. I'm a health economist at Health Technology Wales, and we are a health technology assessment agency that looks specifically at non-medicines in Wales. So we look at the evidence on clinical and cost effectiveness on a particular non-medicine technology, and then we take that to our appraisal committees, and they will produce guidance on whether they think that technology should be adopted in Wales or not. I'm here today just to give you a quick plug, I suppose, for our newly launched scientific advice service. So this just launched last week. And the idea is it's trying to plug a hole, I suppose, that we're often told by developers that some of the requirements of HTA bodies maybe don't quite have that level of understanding about what's actually required from them. I guess specifically on the health economic side of things, that often seems to be the sticking point. And really, as things stand, there's sort of a limited availability of that kind of research capacity. And the capacity that is there is often very expensive for companies to procure. So what we're trying to do is fill that gap with a relatively inexpensive service that hopefully will provide that level of awareness of what actually is required from health technology assessment bodies in terms of the evidence you need to, I suppose, to demonstrate the value as measured by health technology assessment agencies. What are the things that we'd be interested in, and do you actually currently have the evidence base there that's to demonstrate that your technology is delivering that value? And so we do this with a tool developed by NICE called the Meta tool, the MedTech Early Technical Assessment tool, which doesn't roll off the tongue, but that's that's a sort of structured questionnaire, all done with a sort of online platform, which ends up producing a nice little report that summarises the sort of key areas for a technology and whether they've actually got the evidence to support their current sort of value proposition, as NICE would term it, that they're going to offer value to both patients and the NHS. So yeah, and that's it from me. I'll just keep it brief because I can see that we're slightly behind time already. So it's just a cheeky for the Scientific Advice Service. And I'll hand back over to you, Kath, for questions.
Thanks a lot, Matthew. Right, I'm delighted we can open up the chat box now for questions. So if anybody's got any questions that they'd like me to ask the panel, then please feel free to type them in. We did have a number that you submitted to us on registration, but while we're just waiting for a few of those to come through, and they'll be fed through to me by one of the moderators. There was just something I'd like to say, just in response to our speakers. First of all, I'd like to thank them, and in anticipation of being able to hang around and answer some questions. I think one of the things we heard about this evening was very clearly two things. I think one, partnership, and the other Wales. So just touching upon those, very clearly partnership is essential in value-based healthcare and putting the patient right at the centre of that. And I think that was a theme through all of our presenters this evening. So it's with that in mind, really, that I was going to touch upon the second thing, and that was about Wales and why Wales is a good place to come and work if you're wanting to look at value-based healthcare, not only because of the people that we have here in Wales, but also I think because there is that commitment from Welsh Government. It's a policy that Welsh Government have in terms of really creating a focus for us in value-based healthcare. We also have some very clear action in terms of NHS organisations with a focus on it, with the Welsh Government policy led by Chris Jones, and then as a clinical lead for NHS Wales, we have Dr. Sally Lewis. Also, NHS Wales Shared Services procurement are taking a key focus in looking at how we procure in the NHS and taking on board the value-based stream. And also then the financial delivery unit that's part of the NHS and Welsh Government is also playing a key role. And then, of course, we have all the work that's being done in Swansea that Victoria has touched upon. So all in all, making Wales quite an exciting place, I think, to come and start looking at value-based healthcare. So the Life Sciences Hub is also another key element in that. And they are very, very keen to engage with anybody who's interested in picking up the conversation after this evening and the rest of the events that we have this week. So I'm going to go to the questions, and this is a question. I think I'm going to start, Matthew, with you, if that's okay. It says the definition of value by NICE and others is not the same as value as we define it here in Wales, which is a much wider interpretation. Is Health Technology Wales looking beyond the QALY?
We do look beyond the QALY, but I would argue that probably NICE does as well to some extent. I mean, in terms of cost effectiveness analyses, that does largely rely on the QALY. But whenever you do an appraisal of a particular technology, I guess the cost effectiveness aspect is one of the components that we'd expect the panel to consider, but that doesn't preclude other aspects being considered as well. So I know, for instance, we have PPI, patient and public involvement, plays a heavy role in HTW. And so there's always a PPI representative on the group. And they'll bring that extra perspective, which, you know, sometimes that might be captured to some extent within the quality of life aspect of a QALY, but not always. And so, yeah, I think it's recognised that there are sometimes limitations and things that wouldn't necessarily be captured by a standard cost effectiveness, cost per QALY outcome. So I think it's part of a wider discussion.
Okay, that's great, thank you. I think the next one, Dav, is for you and maybe then for Ahmed, which is what the biggest challenges for SMEs in driving forward value-based initiatives?
Is that a question?
For you, yes, if you'd like to start that.
Yeah. So I think from my perspective, I mean, one of the questions that someone kind of submitted beforehand was kind of similar to that in terms of kind of how can external partners, like, you know, such as an SME, you know, help organizations, health boards in this scenario when health boards are just, you know, exploring it themselves. I think from my perspective, for any kind of project, beyond the, pilots and kind of proper deployments to happen, there's lots of different avenues that need to, all align up. And so I think, one of the challenges up until this point of getting, successful VBH initiatives off the ground is that, you might have had an SME that's interested, you might have had, a couple of individuals in an organization, and maybe someone who's kind of vaguely involved in policy, interested as well. But there's all, you need 5, 6, 7, 8, 9 people kind of all coming from different angles to mean that you can get, that kind of initiative all the way through and not end up, taking the trodden path in terms of kind of traditional things. So I think, the challenge is getting enough people from, multiple different prongs, all talking in the same language. And so I think, from my perspective, that's one of the opportunities in Wales is as we kind of, I think, are realizing, there's a small number of, countries or regions where there's enough of those balls in play in terms of saying, well, actually, there's support from that angle, support from here, support from there. So maybe we can, make a real push with, it's not just being a fanciful idea, but actually making it happen.
That's great, thank you. Ahmed, would you like to add anything to that?
Yeah, I'd say one way to really overcome, let's say, the resistance to change, and to try and actually build on some of these partnerships is to try and take these consortium-based approaches, really get as many stakeholders around the table as possible, and really try and find somewhere where you can all develop some value together. I think that's an excellent way to do it. And in terms of also the previous question around quality and value can look different for all the different stakeholders. I think the approach that Wales has taken is great. It's making sure that it's able to collect the right data points, whether it's based on outcomes, whether it's based on activity or resource use from some of these different activities or whatever it may be, and then bring that together and see what's right for your population. Every health economy is diverse, the patients they're caring for, their resources, everything like that. And so that's hugely important. And we feel that if you do want to make it successful, is just build on the foundations of a value-based approach, which is everybody working together with the same end goal.
That's lovely, thank you. I'm going to move on to another question from Lucy, and I wonder whether or not, Ruth, you might like to have a first go answering this. So the question is, how do the panel feel that the here and now pressure to deliver cost savings, the traditional procurement model, can be overcome on the journey to build value-based partnerships, which inevitably take longer? And I suppose the lens of that is completely covered by the additional financial pressures that are going to be on us all through COVID. So Ruth, would you like to take that one?
Yeah, thank you. Lucy, I really don't think there is a quick win to a deep partnership with a service like a hospital or a health board. I do think that there is a greater desire to engage in discussions that are on a different type of a cost model to the traditional model that we would be looking at. But in my experience, if you really want to develop a trusting and a deep relationship with a health board, it's going to take between 12 and 18 months. I think as you have more evidence of success and you have more evaluation pieces of the value that you're delivering to the hospital, those case studies do help you to drive change quicker. And I see it kind of like a rolling stone. I think it's going to get quicker and quicker as more and more health boards and hospitals look at the bigger picture and engage with industry to help them, because we are prepared now to start sharing risk, where I think historically we weren't. So I wish I could give you a here and now, yes, I think it's all going to be better tomorrow. I don't think it is. I think it does still take time to build that trust. But I think it's coming, and I really feel strongly that places like Life Science Hub Wales, who want to get involved in that telehealth economics evaluation and assessment, I think these really start to drive change forward significantly. And I feel the pace is really changing in service delivery to adopt these newer ways of working. I don't know if the other people in industry feel the same, but I definitely feel it.
Emma, would you like to come in there?
Yeah, I mean, I think Ruth, you make an excellent point. I think these are not on the whole, these aren't quick wins, and it definitely does require a bit of a mindset shift, to be honest, which is going to take time. That said, I think there are I really agree with you about the sort of rolling stone analogy. I think once this, we start to build this, the wins will become, much more quickly realised once the infrastructure is there. And I also think there are also opportunities on, to make like somewhat short-term wins as you start to think about just small behavior change, because I don't think sometimes it's not that you need something really big and fundamental for everyone to completely do something differently. Maybe just lots of people doing something small in an area can really start to generate huge potential cost savings whilst also improving outcomes. So I think there are ways that we can do this, but I do agree with you, fundamentally it is a bit of a mindset shift that takes a good deal of collaboration and building that trust and working together.
Thank you. I'm going to take a composite of a couple of questions now, and Victoria, I'd like to come to you if I can. Somebody's put up a question about Once for Wales. It's a particular bugbear of mine, in the fact that I think we do reinvent some things, although things have to be locally owned. But I think there is quite a bit more that we could do on a Once for Wales basis. So if we were going to tackle value-based healthcare on a Once for Wales basis, and really starting to drive it and make it happen for Wales, what do you think it is that we need to do as Wales PLC?
So, and I think that this is something that's really helpful for industry as well, which is that we disproportionately invest when we experiment together, and the energy that we all put into that, the health system and the life science sector, and we need to extract every ounce of learning from that, and to be able to capture that and then replicate it. And to Ruth's and Emma's point, if we could have the opportunity to accelerate that, and if there are learnings that we've got quick wins that we achieve together, that we can actually very rapidly share those, that every health board benefit and more patients benefit much quicker and more efficiently. So doing it, learning it, and then replicating it and diffusing it so that we actually ensure consistently that everybody benefits from it is what we want to achieve.
Absolutely, it's that spread and scale, isn't it? It's always the bit that we sometimes stumble on. Brilliant, thank you very much. We are on time, but I do think we agreed with the panel. We will just take a couple of extra minutes, as long as that was okay with people. So if you need to leave us, then we absolutely recognise that. But maybe we've got time for one more. And I'm going to open this to any of the panel who might care to contribute to it. Obviously, we've been talking about health, but the social care element is just as important in our care and in the healthcare economy. So I just wondered if the panel would like to share with us, acknowledging the opportunities in Wales in respect of value-based approaches, what do we think the commercial partners consider important in terms of unlocking the social care element of our health economy? Anyone going to be happy to maybe start some thinking on that for us? Ahmed?
Yeah, I don't mind jumping in there. So we've been in discussions with different stakeholders within social care, and we've seen that look, the key elements of some of these services are provided using key performance thresholds, key performance indicators, very much similar to many other areas within healthcare. So what we've been looking at is organizations that are able to monitor these patients remotely and collect the right data, whether it's linking directly to the devices or some of these home health hubs, and take data from there and really then enable value-based commissioning of social care services as well. So I think there is quite a lot of advancement there in the background, but I'd say pilots and commercial implementations are a lot further behind compared to direct interventions and things like that.
Thank you. And I think that's one of the areas where with the Life Sciences Hub, we're really trying to join up some of these discussions between the health and care sector, and we have a number of initiatives to try and do that. So thank you, Victoria.
Yeah, I was going to say, and I would completely agree with exactly what Ahmed said, and also just in unlocking social care, I just think that we underestimate sometimes when we introduce an innovation, the impact, the profound impact it has across the whole pathway. And the more that we can understand the impact that it has within the social care setting as well, because if we provide something potentially that's curative or that allows a citizen to be able to go back to work or contribute very differently, at the moment, we don't necessarily see that three-dimensionally. And the more that we can work across the whole system, health and social care, the more that we can start to be able to articulate the real value of any innovation. Because very often we might be able to say, look, it's going to be able to free up hospital care, but we may well create significant costs in an unconfigured health system that's unable to cope with it in the community. And so the more that we understand that and work with social care as well as health, the more effective we can be as partners.
That's lovely. Thank you. Emma, would you like to come in?
Yeah, I mean, to be honest, Victoria has pretty much said it. I completely agree with what she's just said. I mean, I think we are really interested in this area of how we can better connect the social care components of value as well as the healthcare and the broader societal piece. In fact, another one of our Pathfinder projects is specifically around really understanding the socioeconomic impact of different disease areas, actually particularly chronic pain and musculoskeletal conditions. I think, as Victoria said, getting back to work is a sort of fairly obvious one, but we're really interested in how we can look at evidence-based approaches to start building this into technology assessment, but also policy approaches, and how we can kind of pull levers at the policy level. So I think there's lots of ways that we can do more here.
Thank you. That's great. Would any of the others of the panel like to contribute to that? That seems sounds right.
I think, Catherine, it would be really lovely if we could see more joined up processes between primary and secondary care. And this is something that we're actively working on with one of our solutions at the moment to try to ensure that patients from point of diagnosis actually start to be educated long before they've ever hit the secondary care system. And I think it's an area that probably has not been invested in enough. I think that that ability to communicate effectively from GP to secondary phase, it really needs a lot more work. It'll be interesting. Hopefully we'll have some telehealth metrics that I'll be able to report back by the end of next year. But it'll be interesting to see if it actually makes any difference, being able to make that link between primary and secondary care. Of course, we don't know yet until we evaluate the data.
Okay, that's lovely. Thank you very much. So we're a little past our original finish time. So I'm just going to take a couple of seconds more to just thank all of our panel this evening for their contribution, to thank all of you for joining us, and to thank the Life Science Hub team for supporting the event and getting us on air this evening and keeping us going with all the technology. I would just also like to remind you that there are another almost 20 events still to run this week, and full details can be found on the Life Sciences Wales website. So with that, I'd just like to thank you all again and say have a good evening. Take care.